The InUversal Group, a health and biotech market disruptor in Africa and the Middle East, is set to open next-generation medical and wellness hubs in South Africa. Backed by a R1 billion investment, the facilities will be opened in Johannesburg and Cape Town. Joining us to discuss how this health and wellness facilities are expected to assist patients is InUversal Group CEO Dr Kamlen Pillay. Dr. Pillay, thank you for making time for us this afternoon. So this is transforming the way we think about just healthcare, medicine, and hospital. So is this all about then blending the fourth industrial revolution technology and holistic approaches to health?
Hi, Clement. Yes, good afternoon, and good afternoon to your listeners, and thanks for having us on your show. We're living in an era now where we have access to information with respect to our healthcare. There's the industrial revolution is pretty much with us. We all have wearables, and we are trying to find ways to stay healthy. And so what we're bringing to South Africa is the amalgamation of fourth generation technology, which is essentially using our data-driven approach to specialized healthcare, which is precision medicine. And this is essentially a way for us to understand ourselves in a way that we've never worked. Can you hear me?
Yes, we're listening, Dr. Pillay. Go ahead.
Yes, absolutely. So if you think about the way we've been, accessing healthcare in the past, it was very much a reactive model where we went to hospitals and we saw our doctors only when we were sick. This post-pandemic era has ushered in a mentality amongst people to be proactive about their healthcare. And now with DNA testing and us being able to understand what our risks are for developing different diseases, we're able to now have a crystal ball into our healthcare future and able to then use those insights to prevent us from developing diseases that we have a propensity for.
Yeah.
So just to give you a simple example, Angelina Jolie, everybody knows, is a famous actress, about 12 years ago, removed both her breasts. And the reason she did that is because she realized that she had found out that she had a gene which basically gave her a risk of developing breast cancer up to 90% by the age of 30. So what she did was she took a proactive approach to obviously reduce her risk from developing breast cancer. She took a very radical approach by doing mastectomies, but we can also reduce risk of developing cancers by understanding what our risks are by doing screening and diagnostic testing. And the screening and diagnostic testing starts with, the most empiric data that we contain in ourselves, which is our DNA. So in essence, if we can understand what our risks are for developing cancers or diabetes or cardiovascular disease, we can start engaging in activities that can prevent us from developing those diseases. And this is where the world is moving now in a very rapid rate towards what we're calling precision medicine or preventative healthcare. So our facilities that we are developing across the country and across the world actually is geared primarily around helping people understand what their risks are for developing different diseases, and then to use the what we call gamified environment. Most people know about Discovery Vitality and how we've changed behavior and help people to understand their risk. What we're doing with the universal method, with WellCare, is we are using precision medicine to tailor-make people's WellCare journey. So instead of just running in the gym to get 300 points to buy coffee, or to, do the arbitrary test that Vitality expects us to do to stay healthy, what WellCare does is it allows you to have a precision, tailor-made journey on your healthcare milestones, and then rewards you for those milestones as well.
Yeah. And Dr. Pillay, your sound is just perfect. I'm just going to ask you to please just lean back from the camera there, if possible. If you can just move back from the camera so we get the right picture of you. Just tell us about these next-gen medical and wellness hubs that you'll be opening in Cape Town, well, this December, and I understand in Johannesburg early next year. What kind of services will be provided there?
So we're opening what's going to be the world's first WellCare environment in the V&A waterfront. We've got 2,500 square meters in the retail mall, which is above Zara and Louis Vuitton. And essentially, what's the services that we'll be providing there are your diagnostic and screening services for DNA testing, for screening of different kinds of cancers, screening of diabetes, and also holistic wellness from a perspective of sexual wellness, financial wellness, mental wellness, all your organs. So we'll have specialist doctors, cardiologists, to dermatologists, to nutritionists, to dietitians, biokineticists. So essentially it will be a one-stop shop for all your health and wellness needs. In conjunction with that, we also have retail offerings, which is basically your nutraceuticals, your wearables, and all the other types of retail that you would require to embark on a health and wellness journey where you'd have a clear insight into what it is that you need to do as an individual to prevent you from developing diseases that you have a propensity for.
And then how do you think this will contribute to medical tourism in the country?
So with Cape Town being voted one of the top cities in the world, and with South Africa having expertise that's unparalleled around, the medical fraternity, we have innovation in South Africa that, Christian Barnard did the first heart transplant. The CT scanner was invested in South Africa. Many worldwide medical innovations have come out of South Africa, and the InUversal WellCare Journey and Institutes is another innovation that's coming out of our country. So South Africa currently is a tourist destination, specifically Cape Town, but medical tourism is really falling behind in that we are losing a lot of ground to places like Turkey, Thailand, Middle East, where Europeans and Africans themselves are leaving South Africa to gain therapy for medical tourism. So a lot of people go to Turkey for their cosmetic surgery. A lot of people are going to the Middle East for their hip replacements. In Africa alone, $850 million is spent out of pocket by Africans leaving Africa to go and get medical treatment. We believe that South Africa is the ideal place for people to come and have their procedures. And so we're building the continent's first medical tourism precinct in Johannesburg, where we'll have a 5-star hotel, a hospital, plus all of your wellness offerings such as yoga studios, medical consulting suites, and so forth and so on. So this is also a new concept which will attract tourists from across the world to be able to come to a destination like South Africa where there's great medical experts, incredible facilities, and then also experiences that they wouldn't have anywhere else in the world, like Table Mountain experience, the Robben Island experience, the winelands that we have. We've got so much to offer the world which is not being showcased in a way that it could be. So the medical tourism industry is growing rapidly around the world, and we believe that South Africa should be the center for this, especially in Africa.
So, Dr. Pillay, pricing is everything. So how competitive is the pricing?
So, absolutely. The price point for medicine has been escalating at a rate which is, the medical inflation is something that's running away with the ability for people to receive treatment. What we've endeavored to do from a preventative perspective is to make the price point for a lot of these treatments accessible to the everyday person on the street. Also, there's certain medical funds that are willing to pay for their members to have preventative healthcare screening. So you'll find that some medical funds are already having part of their funds available for people to spend on DNA testing, on preventative healthcare. So from a price perspective, very accessible. And there's obviously more in-depth tests and full body screening MRIs that will be for the higher end of the market. But across the entire market, there's opportunities and the price point is accessible for many people.
All right. InUversal Group CEO Dr. Kamlen Pillay, thanks for your time this afternoon.